Great, thank you, Scott, and thank you for the opportunity to talk briefly to you this morning. And some of the themes I'm going to be talking about are going to follow on a little bit from what David mentioned prior. So, who in the room has used TripAdvisor a number of times? Most of you, in fact, probably all of you, and we still do, and it's an expectation that people have. But the health sector's been quite slow in terms of adapting that kind of behaviour. And there's various reasons for that, which I won't go into because time does not allow me that. But suffice to say, the health sector is being dragged into that whether they like it or not. And we're doing some things down that track in New Zealand at the moment, and I'm going to share with you a little bit about that. But it's fair to say that when it comes to consumerism, consumers, health customers are going to drive their own decisions for themselves and for their family. They're going to make the choices both nationally and globally as to where they source information, services and products. And in 2027, they're going to be sourcing all those things I mentioned globally. And they're going to be buying them online, and they're going to be bringing them into the country in terms of products. And we heard David before talking about 3D printers and being able to print medications and things like that. That is going to happen, and people are going to be bringing in and making their own medications in 2027. So we need to think about that environment as we go forward. But before we do, I just wanted to set the context a little bit about HealthPoint. Okay, so we've been around since 2004, and we're the most well-used health service site in the country. We get 1/3 viewers each month looking at health service information, which is quite outstanding. And that is looking for health service information by New Zealand Health Services. And that continues to grow. Now, before we set HealthPoint up, my business partner and I, Kate, I just want to set the context with a personal experience. On my youngest daughter's 15th birthday, she was diagnosed with a renal carcinoma. And as a family, we could not go and find a single place where we could get information about healthcare service providers that helped us understand a little bit about what was going to happen to us, where we needed to go, how we engaged with that. And David alluded to it earlier. If you have more knowledge, more information, better engagement, you potentially will have better outcomes because you've got a better interaction. So for us as a family, you can imagine it was a hugely anxious time. My 15-year-old daughter had her left kidney removed the next day at Starship, and I will say the clinicians, nursing staff, doctors were unbelievable. And that's the one thing that we've got in this country that is really outstanding, is the level of the skills of all the clinicians that are involved in the health system, and I can't speak highly enough about them. Cut a long story short, a week after she had her kidney removed, we ended up back in Starship with the oncologist. And as we were about to go into the appointment with the oncologist, a staff member reached across, keep in mind that a diagnosis had not been made at this point, reached across in front of us and handed the oncologist a whole lot of canteen pamphlets and said to the oncologist, "You'll need these." All of a sudden, you can imagine how we felt as a family. We were in disarray and incredibly anxious. My daughter is now 23 and an orthopedic nurse, and she's fit and healthy and manages her health because the system took care of her. As a result of that, and the experience that we'd had with the clinicians and the way she was dealt with, I ended up writing letters to the CEO and the Chief Medical Officer saying we were so thrilled with how she was dealt with, it was unbelievable, we're incredibly grateful. There was no mechanism for me as a consumer to provide feedback to the people that had been helping us as a family. And so, in my view, setting the context about having a platform to share information from the services themselves and also to be able to provide information was something that I believed we should work towards achieving. So, with HealthPoint, what we've got is we've got information that comes up around the individual. So you put in their address, you can bring up all the services around them, and that includes GP practices with really data-rich information about who they are, what they deliver, how you access them, and all the treatments and procedures that they offer. And we do that for general practice, for community pharmacy, for mental health NGOs, for eye care providers, you name it, we do it. And as I said, that platform's growing incredibly. Now, the next slide I just wanted to sort of builds on that, and this will be no surprise to you. So on the left-hand side, there's a graph there, and this is a customer survey that was done in 2015 by McKinsey, looking at over 2,000 consumers, and they asked them, of organisations that they deal with, what are the most important things to them as an end user or as a consumer? And the dark blue bars are healthcare companies and the light blue bars are other companies. And it won't surprise you that the things that are most important to consumers are that they provide great customer service, that they deliver on expectations, that they make life easier, and that they offer great value. Quite simple, really. It's what we expect. On the right-hand side of that graph, the very start of what we're doing with HealthPoint services, services that are on the HealthPoint platform now, is starting to take shape. For several months now, Waitemata DHB have initiated a program which they call social listening. And what that does is on every service page, whether it's a GP practice, whether it's a community pharmacy, whether it's a hospital DHB service provider, there's the ability for the consumer to provide feedback. Now, the way that we have set this up is based on the NHS Choices platform, because the question is designed to elicit good feedback that you can do something about. And so it's a thumbs up, thumbs down approach, and then you've got the ability to put some comments in there. Now, it may surprise you that all the feedback that the Waitemata DHB service area providers have got, 70% of it is positive, which is a great thing. But there are other bits of feedback that these service providers need to acknowledge, not react to in a negative way, but embrace and make changes because it's what we expect to have happen. We've also just been told that Counties Manukau DHB would like to roll this out on the 1st of July. And then I know that Northland DHB is very interested in this whole project as well. Now, also just to let you know that feedback now only goes to the service. This is what we call phase 1. So it goes to the service and they get all the feedback directly to them. It's not published anywhere. And as you will appreciate, it's kind of a warming up of the situation. So we're moving through that, and we believe that phase 2 for this information will be the publishing of the feedback on the site. So me as a consumer, you as a consumer or a health customer, you can actually go and look at a service provider and understand the feedback and read the feedback that's been provided. In the NHS Choices, you can actually go and look at something like GP practices and compare them based on a star rating. How do they rate one against the other in a specific region? Okay, David's already alluded to this, so I'm not going to go into this in much detail. But there's a whole lot of disruptive technologies coming down the track, some of which are here now. The Internet of Things, we're all connected. Our kids are all connected, and our kids' kids are going to be more connected because it's what they're used to and what they've been brought up on. And I'll give you a really good example. I chuckled to myself when I heard it, but my business partner, Kate, 2 weeks ago was in Starship Hospital with her youngest daughter because she had a viral infection and ended up with a white blood cell count that was horrifically low, and she was open or at risk of infection. 14 years old. What do you think the first thing that she did when she found herself sitting in a hospital bed looking at, I've just been told I've got a low white blood cell count? She went straight onto her phone, she went onto the internet, and she tried to find a place to buy white blood cells. Right? So this is the kind of behaviour that is going to happen whether we like it or not. People are going to expect to be able to purchase things over the internet. They're going to be expecting to be able to bring them in freely. And these technologies are going to be available. So at HealthPoint, what we wanted to do was set up a platform where we could put service information with good local content in there. We can publish in the future, and our belief is by 2027 we will be doing this, putting in ratings on products and services so that people can go and have a look and make decisions for themselves and their families. And that's where we believe things will be going. So other technologies coming down the track, we've all heard about Watson, cognitive computing, bioelectronics, where small miniature medical devices could be inserted under the skin and used to help disease management, genomics, 3D printing. I won't go into those in any more detail. But what I would like to say, just in ending, is there's some considerations that we need to have. We focus on the publishing and the sharing of information about service and what they do. We're starting down the track of customer value and trying to put some measurements there that in time will enable people to make the right choices for them. And so preparing people for their healthcare journey or experience. The same thing is going to happen with access to all different technologies globally. And our kids, just like I mentioned my business partner's child doing, going to the internet and searching for stuff. The real dilemma and the real challenge for us both as a country but as a healthcare service is how do we actually manage that? How do we support patient safety in all of this? Because the world's getting flatter. People have got access to much more information and many more products. And so how do we ensure that patient safety, and how do we facilitate access and the right decisions for members of the New Zealand public? Thank you.